examples of what you're going to run into, okay? Here's our patient. Okay? He's in early recovery. He's doing okay, okay? Now, he's a guy. How old is he going to be? 23. 23. He's a 23-year-old male. Let's give him a name so we know who he is. Go ahead, Jess. Pat. Patrick? Pat? Okay, here's Pat. 23 years old, right? Now, he's arrived here in early recovery. Now, when I say for the most part, when it comes to processing feelings, our patients are going to have to resolve or process unresolved feelings from their past. Remember, you've heard me say that. So let's go back here with Pat. Okay, going to psychosocial. How old was Pat when he started drinking and using smoking pot?
14.
14 years old. So he was 14 years old here. And that's usually about right. Usually 13 or 14 when I've interviewed thousands of patients. But it's usually around 14. So if he's 23 or 24 now, we know he's been using for 9 years. Now, if this was 34 or 44, which, that might be, we might, when we talk about individual treatment, patient-centered individual treatment, we would treat somebody who'd been drinking and taking drugs for 30 years more than, they're a little bit different than we would someone for 9 years, okay? So whatever this age is like this, he's got issues here, back here, 14, 15, 16, usually family, it could be anything, but you know it could be, right? It could be anything, okay? So, when he's here, let's just say he's got 40 days clean. Right? And he's dealing with some issues here. So he's over here, 40 days clean, okay? And he's dealing with some issues here. Now, somebody give me an example of an issue that's going on here.
Guilt.
He's feeling guilty, right? About what? About something back here, right? Okay, so, he's feeling guilty about something back here. Now, when we talk about what the patient is feeling, let me give you an example of what you might hear and what I have heard from patients. Now, in part one of this, on the content and process, where I said in group, and we're going to do something about group later on this evening, but in group is not a complaint session. This isn't a complaint group. And I don't let the patient complain in group, but when you were talking about before, when you said, how do you stop them from telling a story? Like they're telling a long story about, my sister and her boyfriend from college, and long stories that have nothing to do with anything. We don't let people tell long stories because they'll talk about that. We'll smoke all day long, right? So the patient is saying, he's on probation, like that one who was on probation. Here he is in group here now, and he's that goddamn probation officer of mine. He wants me to come every week now. I was coming twice a week, and son of a bitch, he wants me to come every week, and I don't know why. I'm doing it. They'll go on like that, right? Now, does that have to do with treatment that we're doing with this patient? Is that treatment? Is that something we would deal with in treatment? No, not guilty, but he's complaining about his probation officer. What?
I think that you have to deal with it on some level. It's affecting his...
No, we don't do complaint sessions. If he's complaining about his PO is treating him unfairly, is that what is really going on with that patient? No.
Know what the real reason is.
Right. Well, what is he feeling? Angry. He's angry. Okay, at who?
The probation officer.
No, he's not angry at the probation officer. He is angry at himself for being on probation. Okay, so he doesn't know it. But if he's complaining about his probation officer, that son of a bitch, who's always, he came to my house at 6 o'clock in the morning. They're like that, complaining. My PO came to my house at 6 in the morning and woke my mother up, too. And everything was okay. He didn't buy anything. He looked at the refrigerator to see if there's alcohol. Alright, so what he's doing is, in treatment-wise, you want to address why are you on probation? And it's something over here. Why are you on probation? That's what he's angry at. He probably did something over here, stupid, dumb, stole a car, whatever, got caught with drugs. That's what you want to do. You want to focus the patient on why he's on probation. Don't let them complain about being on probation. Point out to them, well, why are you on probation? And try to address that with them. Because he's angry about something that happened back here. For the most part. You can, if somebody does, sometimes they want to get some steam off and you want to let them vent, and that's okay. But you got to focus them on why they are feeling that anger about that at their probation officer, when really, for the most part, they're usually angry at themselves for screwing up somehow that they ended up on probation. Okay, does everybody follow that? I'll give you another example. This is a real life example, okay? The patient was complaining that he went down to social services because they canceled he didn't get enough money on his food stamp card. And he went down to social services, and he was there for 3 hours before they saw him. And he's in group now the next day complaining about being at social services in the waiting room for 3 hours. Because of blah, 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 blah. Okay, so, again, you want to point out to him, why are you on social services? Why do you have to get, what are you really angry, what are you really angry at? And they're usually angry at themselves. Okay? Another one, real life example, the patient was complaining that the light was out in the hallway of his sober house for 2 weeks. And he told that son of a bitch house manager to change that light bulb, and he hasn't changed that light bulb. It's 2 weeks. And when I gotta go to open my door, I'm in the dark, and really, he said he thought he was gonna take 10, 15 minutes of the group time complaining about this. And that house manager, he's not doing his job, complaining about that. Okay, so what's the real issue with that patient?
Why are you at a
sober house? What are you doing at a sober house? Because you just got out of treatment, you can't get a job yet, you can't support yourself, you're still in treatment, you're still in outpatient treatment. The sober house is part of an outpatient program, and you're here in treatment with us while you're in the sober house. That's the issue that has to be dealt with. That's what they're feeling, whatever it is they're feeling. We're going to get back to that guilt thing because that's important. Okay. I've fixed the bathroom thing was overflowing at the treatment program. I'm the clinical supervisor, and the bathroom was running, and they told me. So what did I do? I went in there, picked up the thing to see what was overflowing. There was a bottle of urine in there. They used it for urines. For fake urines. It was in there, got clogged up on the thing, and it was overflowing. But I've changed toilet paper, unplugged plunged toilets, and take my jacket off, roll up my sleeves, and get in and do that. That's something that's easily resolved. But I would point out, why are you in the sober house? Why aren't you home? My wife doesn't want me there. Why doesn't your wife want you there? Because blah, 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 blah. Guilt. Can't go home. That's something that we would deal with back here. Okay, does everybody understand that? Okay. So this is the type of things, what people say and what's really going on with them when it comes to process and how they process their feelings. Okay? So, what is a feeling? Emotion. Okay? Emotion. just so we clarify this right up front, so you know this when it comes to counseling. Shit is not a feeling. Okay? So when they say, how you feeling today? I feel like shit. Okay? That's one of the things you gotta point out right away. Because I have a list of all the feelings. Sometimes you bring that into group, let's identify some feelings. You ever seen them happy faces, the faces, happy heads, and shit ain't on there. So if you ever hear that, point that out right away. That's not a feeling, okay? So if you look at our textbooks there on page 250, it gives you a little explanation of that. For the handout that I gave you for this course, content is got it there is what's content is what a client says, the content of their language. I'm feeling that this is going on what they say. And then feelings, it says, is everybody looking at that on the handout or on the page 250? You're on here. Here. Right there. You got it? Do you have it? I have it here. Okay. Got it marked. Okay. What are feelings? Feelings are body, mind reactions that the client expresses but may not be able to express because he or she, and this is what you need to know, our patients have difficulty expressing or identifying and expressing feelings because they've been suppressed, especially those old, okay? Okay, so one of the things that can prevent them from doing that is that they don't have the vocabulary to identify and express a feeling. Like guilt is one of the good ones. For the most part, it's anger. They're angry, especially when facts got 40 days clean. A lot of times, when patients start to realize what has happened to them, they're pissed off. They've been robbed. They've been lied to themselves. They've been bamboozled. They've been hoodwinked. They've been tricked. They've been cheated. They've been stolen from. Their dreams, their aspirations, all the things that he wanted to do as a 14-year-old, as a 13-year-old, have been robbed from him. And when he gets over here, he's angry about that. Or he doesn't know that he's angry about that, but all of a sudden, especially if it happens 33, 34 people, somebody get clean 34, the head comes out of their ass, and they realize, oh my God, what happened to these 9 years or 19 years sometimes? So they're angry about that. So they may not be able to identify that. So we have to help them identify that and help them process and resolve these unresolved feelings from their past. But this is really in the present. They're angry now. They're guilty now. They just didn't know before. Okay? They deny their feelings. They'll deny their feelings. I told you before. They'll say, I'm good. No problem. I got this thing. I got this. I'm good. I'm okay. I don't need your stupid therapy. Or the person who says, they're in group, they're like this. I'm good. I'm okay. I'm good. It's all right. I'm good. I'll pass. You can go on to the next person. I'm okay. Is that person okay? No. Are we going to go on to the next person? We could. We might. We're going to come back to that. But remember, we're looking for smoke, right? Is that person smoking or what? Okay. And what was the other one yet? Oh, they're unaware of their feelings. They may not be aware. They may not be aware that they're angry and guilty, or they feel anger, guilt, shame, remorse, humiliation, self-degradation, and self-remorse, and self-humiliation and degradation. They feel sometimes, not all the time, they feel like low-life dirtbags. And that's that's how they come and sit in the chair across from us. So we have to help them process those feelings. Because they have no idea how to do that themselves. So when we're in group, when we're in counseling with them, like I said, with what we have to be cognizant of what they're saying and help them to identify what the feelings are behind what they're saying. And identify it and put it out here in the middle of the room, in the group, and let's talk about that. And that's the group topic today. Whatever that is. Whatever the issue is. Who could give me an example of something that would come out like that in group? That's what I say a lot of times when we're listening to what people say in content. And there's a whole thing called process group. There's a process. It's a group topic. It's group process. But a process group, something will come up, a feeling or something that is unresolved with one of the people in the group, and we'll get it out on the table, and we'll talk about it and let everybody identify it and talk about it. Look it up in the dictionary, kick it around, really tear it apart, and how does everybody else relate to it? Well, who can give me an example of something like that? Resentment. What's it? Resentment. They got a resentment. And has anybody else in the group got resentment today? They're all going to raise. Everybody's going to raise their hand. Okay. Good. Resentment. At what? At something happened. Something was done to them back here. I know. I'm not speaking about myself here. Okay? But people are angry at something that happened 30 years ago. 40 years ago. They're angry about something that somebody did or said to them 30, 40 years ago. And I really liked her too. No, I'm not talking about me. I loved her, and she, betrayed me. I'm not talking about me. But that's the type of stuff that comes out, They hold a grudge or a resentment 30 years. They remember something that somebody did something to them. And then they go build up like that, and then they're here, and their attitude is, you got to screw everybody before they screw me. That's my attitude. I'm going to screw everybody. I screw you before you screw me. I don't think you get a chance to screw me. Because in that drug-using subculture of society, that's one of the rules. There's no honor there. They lie, rob, and steal and cheat each other. There's no honor. They'll steal something from you and help you look for it. Is that it? Check under the table. Is that it there? Did you check your pockets? Well, they got it in their pockets. And and they're always there's no honor there. And they can't be vulnerable. They can't process. I'm really feeling vulnerable today. I need to get a little more honest with myself. You don't talk like that if you're in a shooting gallery. That's a cracked in. You can't be honest with your feelings. Or if you're in a bar, talking to the bartender, he said, "Here, drink this, you'll be fine." I'm going through some real feelings today about something, Drink this, it'll be okay. Yeah, take a shot. Don't worry about that, it'll be fine. So this is the way they have dealt with feelings of guilt, shame, remorse, humiliation, self-degradation, anger, all of that stuff. So we're going to help them process those feelings. And in group therapy, what they say, what they do, what they feel, that's what we do. Most of counseling, all of counseling, most of counseling is helping our patients process and resolve unresolved feelings from their past or that are going on right now. Most of the time, I'm looking for one that can give me something. What would be an example of something? A death interference. There's a whole thing with resolving grief, 5 stages of grief. We're going to get to that in the advanced course, 5 stages of grief. But there's something else. Most people have a problem. If we were going to get the group to pick a topic, they would almost pick this every time. What are you going to say? Relationships. Were you getting into them? No. What were you going to say? Relationships. That's the number one thing. Family relationships. usually with their significant other, their wife, their husband, but it's usually for gentlemen, for men, it's they got a lot of stuff going on with their relationship with their wife or their kids. I mean, like we talked about that before. Problems with communication and relationships with their family. It's usually family communication. And then you teach family communication skills, but to help them process that, even to identify that, Connor, to identify that I got a problem talking to my wife, and we've been married for 17 years. We got 3 kids, and I can't tell her how I feel. I don't know how I feel. How can I tell my wife? I've never told her how I feel. Oh, but we love to do stuff. We get the wife in a family session like that. You know, it takes years sometimes to be able to. That for men, we've been trained not to talk about our feelings. Don't talk about your feelings. Don't tell people what you're feeling. And in that drug using subculture that I was just talking about, they ain't talking about their feelings there. They'd be vulnerable if they were sensitive and caring. They'd be taken advantage of by their friends. They'd be vulnerable. It's dangerous to be honest with your feelings in that subculture, dark underbelly, drug using subculture. Okay, so when it comes to content and processing feelings, what people are saying and what they're feeling is sometimes incongruent. And we want to help them identify the feeling behind what they're saying and feeling, or how to identify and say that and process those feelings. And we can use a group setting or individual, we can use a group setting to do that. Okay? Any questions? Well, this is just feelings give color and flavor to the content of what people are saying. Feelings may enhance content. Feelings may contradict the content. Okay, so the feeling may contradict the content, which is what they're saying. I got a perfect example of this. Michael J. This isn't me. Michael J. He had a relationship with the girl that he really loved, right? And he was using, and they were together, and she couldn't deal with him using anymore. And she said, I love you, man, but I can't deal with you when you're drunk. Or I can't deal with you when you're high. I just can't deal with this anymore. And this has gone on and on and on and on. These are fucking catastrophic consequences now, okay? And Mike said, you know, he didn't care. He was going to continue to use. And she said, crying, and we did this in group, I can't deal with you anymore. She was packing her stuff and crying. I can't deal with you. I'm leaving. I love you, but I can't live like this. I can't, because you're crazy. When you drink it, I know that terrible person. I'm leaving, right? And inside, Mike was feeling, stop. Wait. No, I love you. I care about you too. You're the most important thing. You're the beautiful person in my life. I'll work on it. I want you to stay. I love and care about you. That's what he was feeling. And here's what came out of his mouth. Oh, yeah? Well, don't let the door hit you on the ass when you're leaving. And he said, it's like that unringing a bell. The words were out there, and as soon as he said it, he went, like, and he was thinking to himself, what did you just do? And she left. He said, oh, well. And that bothered him for years. Years. What he said and what he felt for our patients during this time here, they complicate the heck out of their lives. Say terrible things to people that they love the most. They lie, rob, steal from the people that love them the most. So, when we talked about guilt, who said guilt? When you talk about guilt, our patients got to deal with a lot of guilt, and they And we're going to help them process and resolve that. Help them process and resolve the wreckage from their past. Not, there's a light bulb, my son was his probation officer, we're going to help them resolve these unresolved feelings of the past. And process those feelings. And it's really, really good stuff. Really going to free them of they're coming in, our patients are coming into your counseling program, and they're dragging a big, like you ever see a big Santa Claus bag filled with presents? They're coming into your treatment program, coming through the door, and they got a big bag of boulders and garbage and crap and shit. They're coming in like this, pulling this in like that. Hi, I'm the new patient here. My name's Joe. They plop it down. Okay, so who's going to be my counselor? You know, who's going to be my counselor? I got some stuff I got to deal with. You know, but they don't know that. They don't realize that they got that. But that's how they arrive. Can we help them? Weak. Can we help them with that? Yes. Okay, that's what we do. We help them with that. They may not even know that they need help with that, but we help them with all this wreckage from their past, unresolved feelings. We help them identify them, process them, and move forward. That's going this way. Okay? Now, one of the things you want to point out to your patients, and this is the last point, one of the things you want to point out to your patient, because you're going to want a patient education, you're going to educate your patients about this, about processing feelings. You want to let them know that processing a feeling is not done in the 45 minutes that they're in an individual counseling session. You're not here like, of course, how could you possibly do that, right? How could you possibly resentment? You've had it for 20 years, how can you do a 45-minute session? How can you deal with it? Or group. Processing the feeling, or the process goes on after the counseling session or the group session. It goes on for days, weeks, months, long time. It takes a long time to process that new information, those feelings. It takes a long time for our patients, already, for me, to process. I mean, I'm thinking of stuff, and I got to kick it around in my head, and I come out with an answer, using critical thinking skills, but come out with an answer, but it takes days sometimes.